Good morning and welcome to the Brazilian American Chamber of Commerce's sixth installment in its webinar series called Surviving COVID-19. I am John Welch, Executive Director of the Brazilian American Chamber, and on behalf of the Chamber, we wish you all health and safety in this difficult time. Today we're going to look at the non-for-profit sector, and non-for-profit institutions are part of the first line of defense and help in the struggle with COVID-19. In normal time, NFPs work in a highly uncertain environment, both on the funding side and also in providing needed education, healthcare, housing, and sustenance to those most vulnerable. During this pandemic, uncertainty on all fronts has jumped by orders of magnitude. Today, we bring together experienced NFP representatives that have vast experience in all aspects of helping the most vulnerable in Latin America, in Brazil, and in the United States. Let me just quickly introduce the panelists. First, we have Christina Mellace from the Resource Foundation. She is the Executive Director of the Resource Foundation, has worked in Latin America for most of her career. And again, I'll remind you, have the full bios in a link to your reminder invitation. And the Resource Foundation provides sustenance, education, housing, et cetera, to most of the region of Latin America and the Caribbean. So there's not many countries where the Resource Foundation doesn't have a presence or counterparties, including Venezuela. Then we'll have Rebecca Tavares, who's the president of and CEO of the BrazilFoundation. She's going to speak about something more particular to Brazil. Before that, before becoming the CEO of the BrazilFoundation, she was at the UN. She is also the interim executive coordinator of Every Woman, Every Child. In the UN, she worked in many, many countries, including different parts of Latin America, Southeast Asia, Afghanistan, India, Bhutan, the Maldives, Sri Lanka, Brazil, Paraguay, Chile, and Argentina. While working in Brazil, those were under her purview. Dr. Tavares went to Yale for an undergrad and holds a doctorate in education from Harvard. Then we have Saulo Barretto, so we're going from the more general to the more specific, who runs the Institute of Research and Technology Innovation, IPTI, in Sergipe, Brazil. He is a civil engineer, and he was the co-founder of IPTI, and he's working in one of the poorest municipalities in all of Brazil, in the part of Sergipe, and works as an international lab for developing social technologies, and it also includes art, science, technology, education, and society. He holds a Ph.D. in structural analysis of complex problems. And finally, we will have Dr. Sylvia Welch, who is a consulting grant writer and has had very vast experience, especially in the New York area, writing grants and also starting a number of non-for-profit organizations of our own, especially in Rockland County. Sylvia holds an undergraduate degree from Brown and a master's from the University of Michigan and a PhD from New York University in history. Before I move on to handing the screen over to Christina, we're going to have two rounds of presentations. In the first round, each of our experts will give a brief presentation about their corresponding institution, what are their main objectives. In the second round, each will talk about what they're doing during the struggle with COVID-19. And again, we're moving from the most general, the Resource Foundation and Christina, to the more specific, the BrazilFoundation and Rebecca, and then to Saulo and IPTI, and finally hearing commentary from Sylvia. IPTI with Saulo and commentary from Sylvia. Just one last thing. I would ask you to please use the Q&A tab for questions. We'll make the time at the end of the two rounds of presentations. The second round, we shouldn't be too much more than 40 minutes, and we'll take your questions in turn, but you can make those questions during discussion, and we'll get to them in the appropriate time. So thank you very much. And Christina, the screen is yours.
Sure. Thank you so much, John, and thank you so much to the Chamber for inviting the Resource Foundation to participate this morning. As John mentioned, My name is Christina Mellace. I am the Executive Director for the Resource Foundation. Our mission is to empower marginalized communities with the skills, knowledge, and opportunities they need to improve their lives across Latin America and the Caribbean, and actually more recently in Canada as well. So the Resource Foundation, TRF, we are located here in New York City, based out of New York City. We are a 501c3. And to achieve our mission, we're really working at collaborating with and connecting the private sector here in the US. So whether that's corporate foundations, family foundations, or individuals with locally led nonprofit organizations and social enterprises across the region. So when we talk about those nonprofit organizations and social enterprises, we're really referencing the TRF network. So currently we have about 370 organizations in that network, and they do span 29 countries in Canada, Central America, South America, and the Caribbean. And our organization, the Resource Foundation, was really founded on the idea that locally led initiatives that seek to achieve developmental goals or advance development at the grassroots level, they're really the ones that are best equipped to have the most sustainable, impactful results. So we really rely on our local partners, on their expertise, on their years of experience, on their existing relationships and partnerships with their own communities in order to make these locally led initiatives really as effective as they can be. And as John mentioned previously, our partners, it's a very big network. We're very proud of the network that we have, and they span a lot of different programmatic sectors. So from affordable housing, financial inclusion, women's empowerment, health, education, there really is a little bit of everything. And I think what I'd like to touch on just very briefly is really that last point there that's in bold with disaster, humanitarian crisis relief. So what does that look like? How do we generally work in those contexts? We have been doing this since about 2007, where we really started partnering with some of those US-based foundations, corporations, individuals to help connect them with these local organizations that were seeing the real needs in real time and then implementing programs that were able to respond to some of those local needs. So more recently, the back-to-back earthquakes in Mexico in 2017, the back-to-back hurricanes that hit the Caribbean extremely hard in 2017, the Zika virus outbreak, especially in Brazil, and I think it was 2016. And then also most recently, I would say, we were engaged in the Venezuelan refugee crisis, also in Brazil. And how we generally work is really reaching out to our partners to understand what their needs are in the communities. And we do have, because we have such a diverse group of organizations in our network, we are usually engaged in response and recovery relief program in a lot of different ways. So we do have immediate relief as well as that secondary and tertiary stage relief, which is more focused on the revitalization and the reestablishment of these communities and economies. And you can see on the right-hand side just some examples of how we have been engaged in disaster programming in the past, kind of our standard programs, I would say. But in the second half, the second round of presentations, I'll go into a little bit more, what does COVID-19 look like for us right now? Thanks.
Thank you very much, Christina. Now let me turn the screen over to Rebecca Tavares of the BrazilFoundation.
Hi, thank you, John. I have now somehow lost my mouse seems to have gone out. Let me just hold on. Here we are. Yeah, I'll use my. I'm going to show a very brief video and then talk to you just for a few minutes overall about the Brazil Foundation. So thank you for all of you for being here with us today. I am thrilled to meet you all virtually, and I'll just say a few words in general about BrazilFoundation. As you could see from our video, it's the 20th anniversary year. We were founded in 2000, and we were founded by a group of Brazilians in the United States and in Brazil to extend at the community level organizational support that helps the smallest organizations, small enterprises get on their feet and contribute to transformation at the local level. We're a leader now today in philanthropy in Brazil, and we connect individuals. These are donors as well as families, businesses, and other larger foundations with projects that they can support to transform Brazil. So far, we've funded over $50 million in Brazil. We've funded over 600 organizations in 26 states and 228 cities. And we work in the areas of education and culture, environment, health, human rights, civic engagement, and socioeconomic development. So to give you this is a very broad overview. Our main concern is working to build leadership, entrepreneurship, sustainable communities across these thematic areas. And I will talk in a few minutes about more of our work in response to the COVID-19 virus. Over to you, John.
Very good. Thank you very much, Rebecca. Now we'll turn to even more specific. Saulo Barretto of IPTI.
So good morning, everybody. Thanks, Chamber, for the invitation. I'm going to share my screen to help me to explain a little bit more about IPTI. I hope it works. So IPTI is, first of all, I'd like to show where we are. We have a global lab in Santa Luzia de Itaim, in south of Sergipe. It is one of the poorest cities in Brazil. It has about 14,000 inhabitants, 9,000 live in rural areas. The traditional economy is traditional fishing, small farmers. Santa Luzia holds the position number 5,268 in the Human Development Index among the 5,500 cities in Brazil. In the last data from the Ministry of Development, the 58% of the people are beneficiary of Bolsa Família program. That means people that lives below $2 per day per person. But on the other side, Santa Luzia Itaim is located in the largest areas of mangrove Atlantic forests in Sergipe. IPTI has this city as a lab, but we also have offices in New York, and we have a representation in São Paulo, and very soon, we hope, in London. So what we do, which is our main purpose? First of all, is to transform Santa Luzia in a showcase of human development through a model based on an association of art, science, technology, with very close partnership with the local community. And we do that by doing two main strategies. One, develop social technologies in 3 areas: basic education, entrepreneurial education, and basic health. And the second, by disseminating social technologies from Santa Luzia to other regions in Brazil and abroad, but also to systematize the model of Santa Luzia to make possible to replicate this full model in other communities in Brazil and abroad. This is our human development model. So as you see, we have the 3 main areas. Everything is systemic and evolving in the 3 areas, and everything is oriented to using this in scalability. What is social technology for us? First of all, it has to be an innovative and effective solution for a social problem, which is created together with the community. So community is not beneficiary, community is part of the research team because they have a kind of knowledge that no one has. You can have the best Ph.D. doctor from Harvard, but he never lives the local dynamic as a local teacher lives. Second, it has to be scalable. So it has to be able to be replicated in other contexts. And third, has to be sustainable. So we have 3 bullets. First, efficacy. Second, scalability. And third, business. I give an example. We have a project in art for adolescents. And then after a few years, we reach this kind of efficacy. After this level of efficacy, all the young talents became art teachers in the local schools. Then we achieve scalability. Last year, we finished 1,800 students receiving art in schools with zero costs. And third, sustainability, that means become social business. They create the Casa do Cacete business. On the top, you see some products. Below, you see some partnerships they have done with brands like Osklin or Insecta Shoes. And I would like to finish my description about IPTI with this project, Synapse, which is a project on literacy. That means children between 6 and 8 years old. I like this project because it shows really how hard it is to make this kind of thing in Brazil. First of all, we spent 6 years just to develop it until the efficacy level. We were very lucky to get the financial support from 2 companies because it's very hard to get funding for 60 months just to achieve the efficacy. After we get the funding to test the scalability model, so we reach 130 schools, 300 teachers, and 7,000 students. And now we are in the sustainability phase, because in Brazil, you cannot trust on governments, mainly on small governments. So we need to think about a long-term perspective, because those teachers have received in the last 10 years, 15 years, more than 10 different types of formation, because each new governor brings a new solution, a miracle solution, and everything they need is a long-term perspective. I share with you a short video about Synapse and the social business that Synapse has been transformed, which is the Synapse Teachers Network.
Muita gente não faz ideia de como é a vida de professor de alfabetização, principalmente dos pequenos municípios do Brasil. Por exemplo, é comum termos que lidar com turmas muito seriadas, com alunos de idades diferentes numa mesma sala de aula e, às vezes, alguns com deficiências cognitivas. Outra dificuldade são os cursos de formação. Cada um de nós já passou por diversas formações, cada uma numa direção, sem continuidade, produzindo pouca transformação em nossas práticas pedagógicas. Em 2010, professoras de Santa Luzia do Itaim e IPTI começaram a construir o Synapse, uma metodologia de alfabetização que fosse adequada à nossa realidade e que produzisse reais mudanças na qualidade do ensino e do aprendizado. O Synapse associa o conhecimento das neurociências sobre a aprendizagem com o nosso conhecimento sobre a realidade de nossas salas de aula. De maneira simples, a gente aprende a fazer bem feito 2 coisas essenciais. Contextualizar a aula, incorporando o conhecimento dos nossos alunos e estimulando para que eles tenham um papel mais ativo durante as aulas. E planejar por objetivo de aprendizagem. A gente pega o objetivo da matriz Synapse e planeja atividades para um período de aulas, definindo as estratégias que vamos usar para os alunos aprenderem cada objetivo. Outra coisa bacana do Synapse é o modelo de escalabilidade, onde as professoras que dominam a metodologia atuam como disseminadoras nas próximas escolas. Os encontros de formação ocorrem periodicamente em polos, geralmente envolvendo professores de escolas e de municípios diferentes que quase nunca têm a oportunidade de se encontrar e trocar experiências. Aos poucos, este modelo nos mostrou que estávamos construindo uma rede de conhecimento. Por isso, criamos a rede Synapse, para que todos os professores que usam adequadamente a metodologia Synapse possam se ajudar mutuamente, para que possamos engajar toda a sociedade num processo de longo prazo, como uma alfabetização de qualidade para todas as crianças. Eu sou Sylvia, professora de Propriá Sergipe, e estou atualmente como secretária executiva da Rede de Professores Synapse, a RPS. Junto com muitas outras professoras e professores, queremos e vamos mudar a realidade da alfabetização no nosso Brasil. Se queremos o país que sonhamos, cada um tem que fazer a sua parte. Nós estamos fazendo a nossa parte. Junte-se a nós.
So we have currently 18 social technologies. In my final remarks, just to warm the discussions, I put some bullets. So complex problems require always complex solutions. It's very complicated to convince the social inverse about that. Also that complex is not complicated. Complicated not to think complex. We also have to think about the long-term perspective because we are talking about mindset transformation, not intervention. And we need innovation, commitment to risk, and systemic approach. So these are my final remarks. I hope you have a grateful discussion up front.
Thank you very much, Saulo. That was great. And now I'll invite Sylvia to give her first comments and what her role is across different non-for-profits. Sylvia?
Forgot to mute, sorry. I think the presenters have taken the wind out of my sails as everything has been so excellent. And one of the factors that I've learned over 30 years working with not-for-profits in the New York regional area is that we've been long too dependent on government funding. We have the network and the organization that is really just forming in Brazil through not-for-profits such as IPTI. But we have the network, but what we don't have is a real commitment or an understanding or a curriculum towards sustainability. And I think of all the remarks and the presentations we just heard, that's one of the key factors. And I think our discussion in the second round about what COVID-19 is doing in terms of our meaning the not-for-profit world, reaction to being on the front line, extending resources we may or may not have, and then knowing at the end of this, we've fulfilled our mission, we've gone beyond possibly our mission, and who will be there, what funders will be there, what programs will be there to keep us going in the long term. So I think sustainability and looking at long-term development issues is key to this whole discussion. So I will step back and listen again to our wonderful presenters in terms of how they're looking at this crisis and what they think or are they're going to do or what they already are doing to enable to sustain their work when many of our corporate partners may disappear or not be able to continue to sustain us.
Thank you very much for that, Dr. Welch. It's a perfect segue into the next round. So I'll hand it back over to Christina to talk about what the TRF is doing to combat COVID-19 and also on the problems and challenges on the funding side.
Sure. Thanks, John. So I will share my screen again. I'm happy to be back to talk a little bit more about what TRF is doing in terms of the COVID-19 response. So as I mentioned previously, we've been working in the disaster relief response area since 2007. And typically what we'll do anytime something happens is we'll reach out to our network partners in the affected area and get a better understanding of how they've been affected, what needs are they seeing on the ground, and are they thinking of getting engaged in some type of response, relief, recovery programming where funding to be available. I think the COVID-19 situation presents a particular challenge in this because obviously the affected area is so incredibly large, it's an entire region. So my team and I have been, working in overdrive to really contact all of our different partners to really understand within all the different countries, in the different communities, what are they seeing and what does the response look like in their respective neighborhoods. And I think one thing that we have been seeing overall, kind of just to take a step back on the regional landscape, I think on the left-hand side, you can see some of these numbers that we were able to pull from the Johns Hopkins site about, total number of confirmed cases. And I think the numbers related to cases, deaths, and mortality rate are certainly an important part of the conversation, but certainly similar to the US and what we've seen. There are certainly within different countries areas or communities that may be more affected than in others. And I think when you get down to, if you're just looking at numbers, smaller countries or island nations in the Caribbean, for example, may not make the list, but it certainly doesn't mean that the situation there is, any better. I think, the commonalities that we're seeing across the board are really that situation is very dire when you think about the fact that Latin America and the Caribbean are really still, maybe 2 weeks or so behind the US, similar to how the US was kind of 2 weeks behind what was going on in Europe. There still exists the possibility that they're still on the way up. The situation hasn't really tipped yet. So I wanted to just pull some of these data points kind of to have as a point of context, but on the right-hand side, kind of some general things that we're seeing across the region. Again, that the response has been kind of relatively slow. There's a disconnect, of course, between reported numbers that really has to do with testing and what testing is available. And of course, I think in some of the communities that are a bit more remote, I'm sure that similar to in the US and in other countries, there's not information coming in from all corners of every country. So I think that's just a reality of this type of situation in general. But we're also seeing a lot of issues related to food security. I would say especially that's been the biggest thing we've seen so far. And when you think about, especially again, thinking about the Caribbean and some of those island nations where they rely on imports, barges coming into the ports themselves to bring those highly needed supplies. The ports are closed, the ability to get those supplies is quite limited. And on top of all this, the fact that there are curfews that are being put into place, that is also, or any type of limit on individuals being able to gather, that's having a particularly hard or harsh effect on those that are engaged in the informal sector, the informal workforce, but then even more so on all of our partner organizations across the region. So many of them run after school programs, or there are workshops, or there are different types of activities that do, of course, require that people come together to either receive training or receive care, receive materials, whatever it may be. So I think, similar again to how we're seeing things evolve in the US, I think there are a lot of similarities with what we're seeing, those situations mirrored to some extent in Latin America. So again, as I mentioned, a lot of widespread outreach to our partners, and we're seeing an incredibly high level of need. But to break it down into some more specifics, I had mentioned previously, the idea that especially those that are involved in the informal workforce, and even those that aren't, there's just high unemployment, which obviously can cause a lot of stress and additional strain, coupled with food scarcity and real concerns about where meals are coming from. That is also led to kind of that third point with increased domestic violence and mental health issues, where there are some, families, of course, that are living in precarious situations. This reality is only further exacerbating that, and they're unable to now go out and seek, time on their own outside of the home. If they're confined to the home, there may be, just general overcrowding. There's a lot of people living under one roof, and that can tend to make for a stressful situation, certainly. Another thing that we're seeing, that fourth bullet point, with comorbidities due to high rates of diabetes and hypertension. I would say we're seeing this particularly in Mexico, one of the highest diabetes rates. And as you may know, some pre-existing conditions like diabetes can mean that if that individual were to get COVID-19, it can be even more serious for them. So that's a real concern as well. Lack of awareness on proper hand washing and hygiene, similar, I think, too, to what we've been hearing probably with a lot of our colleagues, but certainly widespread. This idea of, if children are kept home from school, how are we able to continue to offer them educational resources or productive ways that they're able to remain engaged so that they don't lose out on crucial learning in their development. And I think we see this even more with younger children. Infrastructure and capacity limits at healthcare centers and hospitals, need for protective personal equipment, PPE, among healthcare workers. Those, of course, are high need. And then that last bullet point was something I wanted to touch on additionally for an extra moment, this idea that a lot of our partner organizations, because they've had to suspend some of their standard programs, there's a real concern about where, if we need to suspend our programs, we had certain commitments for funders to support those programs. Are those funding commitments now, going to go away? And right now, where they are hoping to keep their staff on and be able to continue working remotely, for some, they're able to adapt to some type of virtual programming, and others, it's really, that really just may not be an option, maybe because their beneficiaries don't have access to the type of technology that's required to do some virtual programming. Maybe it's just not accessible to them for whatever reason. So we're seeing a huge increase in need for flexible funding support. And that's really looking at, rather than program-specific grants, is there an ability to also provide flexible spending for operational costs, or flexible funding, to support operational costs? And that's something that I think in the international development field, it's not always something that funders are really comfortable with, for a whole grant to go to that type of support. But I think right now, more than ever, we're really looking at, this is the immediate need right now, so that the organizations are in the position that when this all blows over, they are able to reestablish themselves. And one really quick additional note is that we are working, seeing all these different needs, we're working on a number of different programs that help to address those needs. Right now, we're certainly seeing we're seeing a lot of encouragement and a lot of interest, I think, in COVID-19 response programming, which is excellent. However, a lot of it is focused right now on the immediate, and I think that does make sense given the fact that, what the current situation means in trying to curb the spread of contagion and all of that. But as an organization, the Resource Foundation, and I think kind of further to what Sylvia was mentioning just previously, we're always looking at, even in disaster situations, where is the opportunity to also build in resiliency, or talking about how can we use the present situation to also provide us with an opportunity to ensure that if something like this were to happen again, can we be better prepared? And is that something that we can kind of build into our project methodologies and into our project plan, so that it's included as part of the larger program in general? But there on the left-hand side, you can see kind of where we're seeing the most interest for thus far. I would say food and hygiene kit distribution has been huge. We have a great network of food banks that we work with that have taken an incredible role in ensuring that beneficiaries, oftentimes nationwide, are still able to access the sustenance that they require. And a lot of different examples there on the left-hand side. But I think something else that's really encouraging is that we're continuing to see a focus on mental health and psychosocial support, which oftentimes following a disaster, we see as being absolutely vital to the situation, and ensuring that individuals are able to access that mental support health. A lot of our partners in the Caribbean are saying that suicide rates are jumping in particular. So really encouraged to see that added focus on the psychosocial and mental component.
Thank you very much.
Thank you so much.
Thank you, Christina. And now let's turn to Rebecca and how the BrazilFoundation is attacking the COVID-19 situation.
Yeah, thank you, John. So we would like to, I'm going to give this a full screen. Yeah. We would like to, thank you again for having us here today. I just spoke, and I really want to appreciate Christina's, all of Saulo's and Sylvia's comments, but I want to especially take up the sustainability question, and also Christina's mention of the need for operating support. So in just a minute, I'll get to that. This is the introductory, which I've already mentioned, and To start on our COVID campaign, we launched it on the 19th of March, so a little over a month ago, and we have brought in much more than we actually had originally established as our goal. It was originally just a couple 100,000 in US dollars, and it's already now up to 1.2 million, and we still have lots of donors that are approaching us. So it's been an overwhelming generosity that we've seen from Brazilians from around the world and from within Brazil, and also with corporate partners and foundations that want to come in and again, very emergency level support. This is not the type of support that the BrazilFoundation typically has provided. We've been much more about, social transformation and social justice and economic development, but at this moment, we are shifting gears completely into emergency support. We've already supported 24 organizations in 6 states, reaching about 81,000 people by our estimates. And we do tend to provide, very similar to the Resource Foundation, emergency level food aid and the sanitary supplies that you can see here in the photos, and very much similar to what Christina mentioned. And I think I want to underline Christina's mention also about domestic violence and mental health support. These are areas that I think we need to look to the future as well. I mean, there are emergency situations now, but over time, the post-crisis will reveal a lot of the trauma that probably is being held at bay right now. So we want to be sensitive to that. Into the center of this slide about strategy, I wanted to just say a few words. And again, very similar to what Christina described, we have an ongoing grants making process, and we're in the middle of it. But because we see that the organizations that applied for a certain set of activities are now dealing head on with the crisis, the pandemic in their communities, we are providing the opportunity for those proposals for project support be switched over to operational support and to emergency support in the communities where these organizations are doing business. So we're trying to be very flexible, and we're also being much more flexible about our timeline. And the existing grantee organizations also have the ability, if they need to, just because most of them have suspended activities that involve, close contact with community members. So we will also be flexible about allowing those organizations to use the project-specific support just to maintain operations and keep the families that are supported by those organizations with enough to get through the crisis. So we found a lot of businesses have been especially sympathetic about wanting to respond. And so we have the employee match portals for a number of different companies that have been generous with that. And we have also other companies that have just been, willing to step forward in a very generous way. Too many for me to mention right now. But I wanted to note some of the issues that we are dealing with very seriously, which is the question of transparency. When you have a crisis, and we've all heard the stories about the crisis response and humanitarian efforts in places like Haiti, where millions of dollars of aid just seem to disappear into thin air. So this is, of course, on a much smaller scale in terms of the funds that are involved, but we're very attentive to the fact that the organizations that are preparing the food baskets and the supplies, et cetera, that they are sourcing from local businesses, that we know who the sources of who's providing the supplies for these emergency kits and baskets that are going out into the communities. And we want to ensure that the local communities are thriving in the sense that the forward and backward linkages with small businesses and stimulating consumers to buy locally by supporting the local businesses to provide those supplies to the degree that they can. And we also want to make sure that the created overnight emergency supplies are actually who they say they are. So this is an issue that we're paying special attention to. And then we have a task force looking at post-crisis recovery and rebuilding. So we want to look at what the role is of private sector in ensuring that small businesses that may have either collapsed or experienced incredible difficulty during this period are supported to get back on their feet. As Christine mentioned, also the informal sector is especially affected by this and will continue to be affected, and may, you know, in these cases, it's the hunger and the emergency relief that's needed, you know, just to keep those families alive, because they've been depending on activities that they're no longer able to engage in. So we want to look at the economic development piece, and we also want to look at strengthening civil society so that they will be able to be resilient after post-crisis. We're very concerned about what the governance structures are at local level, and how the groups that are community-based groups and represent the favela organizations and the associações de moradores and small micro level, I should say, democratic institutions are holding their local governments accountable, and that we can really strengthen civil society through this process. So we're looking towards the future in that way. And we're really grateful for all of the support. We accept support from individuals and businesses and foundations, but we also want to acknowledge that several of our donors have wanted to have a longer term commitment to giving in Brazil. And so we have new instruments for giving that we've been able to provide them with, such as donor advised funds and the designated funds that allow some of the nonprofit organizations from Brazil, the civil society organizations in Brazil, can establish a fund at BrazilFoundation and then raise dollars from abroad. So we've had quite a bit of interest, and our, you know, from our point of view, that's all about who we are, is ensuring that the organizations on the front lines of social change and of the emergency response receive as much assistance as possible, so that we're more than happy to assist and enable the Brazilian organizations to raise funds on the, you know, from the donors in the United States. So I think I mentioned that we've reached 18,000 families, and these are the kinds of supplies. On your right-hand side of your screen are the numbers of the organizations that we've already funded. There should be 24 there. We have a few more already in the pipeline, and we will continue to be expanding as the funds come in. Some of our donors want to fund a specific organization. Some of the donors want to fund a specific set of activities. But many of our donors are giving us, you know, unrestricted funds so that we can apply it to the emergency needs in communities all over the country. So that's it for me now, and I'm looking forward to talking more during the Q&A session.
Thank you very much, Rebecca. That was excellent. Let me now turn to Saulo Barretto, IPTI.
Hi, sorry for being out, but my computer has a problem, so I'm back. So look about the Sylvia's question in the beginning. I will split my talk now in two areas: the COVID-19, of course, but also how can we make sustainable during and after this crisis. So despite the fact we are in the middle of a very vulnerable region, we work essentially with innovation. So we don't do social cares or assistance like that. So we try to make innovation. In that field of COVID-19, we have currently two main projects. One, we are launching next month an app, because we are developing an app together with Bayer, PER in English, is an app to help to create a kind of social control. So how the community can be engaged to control vectors. The focus before the crisis was dengue, chikungunya, and Zika. So the Aedes aegypti mosquito. Now we are increasing this extra vector, which is the human being, because the COVID-19 is also a vector problem. And we are creating a mechanism how the community can be engaged on social control and help the health system to monitor, provide information, etc. So it's important to highlight that we are always, now everyone is focused on COVID-19, but the dengue, chikungunya, and Zika is still a big issue in Brazil. So the idea of this mechanism, this app, and this data bank is to provide also for public managers the possibility to overlap kind of endemias like Zika and COVID or etc. But also look about the Chagas disease, other types of diseases that are transmitted by vectors. This is one issue. Focus on innovation. Very soon we'll be aware about the first version of this app. The second thing is the teachers from RPS, they are creating videos and activities. So the students and the families, mainly the families of the people from the health system, which are home, blocked in home. So how the kids can do activities in learning or joys or telling histories. So the RPS has created a movement how to help these people when they are obliged to stay home. So these are the two main activities we are doing. Regarding funding, which I think was the Sylvia question in the beginning. So IPTI deals with very basic social problems like literacy, anemia, school management. So things that are lifelong problems. So everything with us, when they reach the sustainability level, like you saw Casa do Cacete or RPS in both cases I show, they start to raise money as a business. Casa do Cacete is a profit business, RPS is a non-profit business. And from those business, IPTI receive a kind of royalty. So we are talking about, as a very American model, then we develop an innovation and you register this innovation, and when this innovation becomes successful, you receive a kind of income back because you have developed the innovation. Of course, the main purpose is to keep the innovation alive, but if there is an extra money, this comes back to IPTI. But as I said, we create solutions for very, very specific basic problems that occurs in all Brazil and other countries. For example, the synapse is currently being reapplied in Maranhão state, in Bacabeira, funded by BrazilFoundation. The month before COVID-19, we had a lot of companies looking at us to bring the solutions to the regions they have some investment or they have a special interest. So I strongly believe that IPTI now is capable to survive through this COVID with very strong, I would say, efforts, but we will survive, but we'll be strong enough after the pandemic to help other cities and companies and investors to bring effective, scalable solutions for these regions because, as I said, everything with us focus on that. I think this is one point that many NGOs, mainly, I don't know abroad, but in Brazil, when you are dealing with real local problems, they have a problem to systematize and transform this knowledge, which is very specific and very precious, in something tangible. So if you deal with kids with mental disease, why not to transform this whole knowledge that you get along the years in some kind of service or product that you can also put in the market in the future? So I think the NGOs need to shape a little bit the way you do things, because we are doing things that no one are doing in the field, living there, knowing very well the problem and the people and the dynamics. So we need also to have this mind focus on the oriented to business, to monetize the knowledge and the solutions we create, to minimize the dependence on external donors and funders. Now is a time very complicated for many NGOs that are completely dependent on this kind of donors. Okay, if they have something to offer in terms of COVID-19, nice, but otherwise they are completely disappeared now.
Thank you very much, Saulo. Some great insight into what you're doing and how you're getting through this. Let me turn it over to Sylvia now, and she can share with us her perspectives, perhaps questions also for the panelists, and maybe talk a little bit about what's going on in the New York area and what you've seen that is similar and maybe a little different. So if you have to unmute.
I'm sorry, I keep forgetting. Again, the presentations are excellent and very, very pointed to my concerns, not only now, but in the long term, as I have said earlier, that the sustainability issues, for us at our scale, it's different. I'm working with a number of not-for-profits as well as municipalities. And we are, for the most part, at this point, relying on the federal government and the state government to come through. I'm doing a number of applications to FEMA, you know, the Federal Emergency Management Authority, to recoup costs for protective gear, et cetera, for cleaning out village halls, having to sanitize them and such. And I think we have become so sophisticated, at least in the New York area, and certainly in New York State, the New England area, so sophisticated in our networks and our ability to access government funding, that in a way, it may be that two-edged sword that's going to come against us. And there has not been enough work to make ourselves sustainable, to develop curricula, to develop ideas that we can market. I've worked with 2 or 3 not-for-profits that I set up that was their total goal, to fulfill their mission, but to enable this tool to be a marketing tool for the organization and to get subscriptions, to get download apps and whatnot. And I think there is a feeling, at least from the organizations I'm working with, that the state and the feds with Cuomo keep pushing will bail us out. And we have to really look differently at how we are going to exist in the long term. And I definitely do not have those answers. I think, you know, Saulo's answers are perfect. It's just our mindset has to change because we are so terrifically networked. We have the internet. The teachers can teach at home. Will that be the future, that the teachers are teaching online? How do we sustain that? How do we deal with the unions? We have a bureaucracy of support now that may be an inhibiting factor to developing our long-term sustainability. And I throw this out with the hope that this is not the truth, that in fact, we'll pick ourselves up and go back to almost what it was. But I think definitely we certainly have to look at how we're going to fund this stuff and how funders are going to work with us. The Brazilian Foundation, the Research Foundation, you folks are very much focused on but building strength and sustainability to the organizations you do fund. I know there's immediate crisis, there are immediate needs that have to be taken care of. And I think our corporate funders, our government funders, and some of the larger foundations like Ford and et cetera, that only the big boys actually qualify for, need to look at, am I giving money to build for the future, or am I sustaining a program immediately? And this kind of planning, I think, will definitely, economic development as well as transparency involved, will definitely have to be part of the not-for-profit picture in the long term. So overall, those are kind of my general remarks. I find everybody's response so engaging, and to be able to pull everything together so quickly, to organize your funding, to get companies to employ match things. And again, it's the wonder of the internet, but of course, many of your actual organizations are not connected, but your donors are, thank goodness. And again, in the States, we do have that ability to network like that. But your ability to transform and quickly access money and program, and then follow the money, make sure it's going to the right place, it's getting done when it has to get done, because you have all those feet on the ground. It's just tremendous to listen. And in many ways, again, with our incredible support network, we don't have the follow-up. We have probably, I don't want to go into that part, that more people taking advantage of this illegally than they should. And we tend to throw money and just not look, but you folks live it, and you're down there living with your communities, transforming your communities, and that's really, really important. And my hat, if I ever wore one, is definitely off to you. That's kind of it, John, because I am really pleased at the breadth of the presentations, and again, the focus on how do we stay alive in this immediate crisis, and what have we been planning all along for the long term. And I think that's the greatest lesson we can give anybody in the field or interested in being a donor to this, to not-for-profits.
Thank you very much, Sylvia. You brought up some excellent points, and we have some excellent questions already from the attendees. Let me congeal. There's a couple that are related. The first has to do is, okay, and it has to do with sustainability on the funding side, as we heard a number of the panelists say, you know, what happens at the day after? Will this surge? We've seen a huge amount of solidarity in Brazil and in Latin America as a whole, as well as the United States in terms of donations and so forth. Again, is it a question of funding the current emergency or what happens later? And certainly in my dealings through different 501(c)(3)s, Latin Americans are very generous people, especially Brazilians, but because of this sort of paternalistic role of the state, they tend to not have that many good counterparties. And I know Rebecca, the BrazilFoundation and the Resource Foundation, both of them work very heavily in Brazil to find good counterparties. But the question is perhaps could this be a transformation? Do we get private sector donations? And I know, Saulo, you, a lot of your funding comes from corporations on the private side. And then finally, someone asked, what's the difference between, can you compare and contrast philanthropy in the United States and Brazil? And I think that's certainly one of them. But again, this is on the funding side, and we'll tackle the other side after you all have a chance to respond. Let's start maybe Rebecca or Christina. Go ahead, Rebecca. You have your so
yeah. Thank you. These are both really pertinent questions, and I think I'll start with the second one, which is what are the main differences and similarities between the challenges in philanthropy in Brazil and the United States? And I think, John, you that would be my answer, is that the role of the state in Brazil has been predominant, and particularly there was a 20-year period of authoritarian rule where during that 20 years, the philanthropy field just blossomed in the United States, and it did not in Brazil because of the type of government it had. So the United States has a long tradition. The United States also has a lot of this independent streak, so that, you know, everybody wants private solutions, and it's very common for people to, you know, not want the government to get engaged in their work, whereas there's a lot stronger role of the state in Brazil. So I think that's a big part of it. But I do think that the role of philanthropy in Brazil is developing now. I won't say it's along the same lines with the same model as in the United States. It has its own, you know, unique features, and but it is really clear today that Brazilians are sensitive to the needs of the least among us. The response has been tremendous, and it's been strategic, as well as saying, okay, we've got to go out to the front lines and, you know, get food to the hungry and get the basic soap and water and alcohol gel and the sanitary supplies, as well as other movements which we are not involved in except in a supporting role, and because we do have donors that want to pay for hospital beds and they want to pay for ventilators, and we refer those donors to the other organizations that are coalitions which are actually procuring that kind of equipment from abroad to really beef up the capacities of the healthcare system. So we have some donors who are also interested in science, and they want to fund the Fiocruz, which is a world-class research institution developing tests and vaccines. So we've seen a lot of sensitivity toward the least among the Brazilians that under other circumstances, under the business as usual, might not have been there. And so in our conversations with those donors, we've also really found and been impressed by the degree of forward thinking that these donors are engaging in. And so we have, people who are really generous in the COVID response, but they're also saying, okay, after this, I want to work on restoring rivers in the Amazon. Or after that, I want to do work on women and children. And so they're already making plans. And these are the donors who are establishing funds with the foundation. They're thinking longer term, and they're thinking about their philanthropic goals beyond the crisis and the rebuilding after the crisis. So we're finding, I think, that the field of philanthropy is just kind of, in my view, overnight transforming to be more strategic, and also more generous than we had anticipated.
Maybe Christina, you want to talk a bit also about your experience with the sort of funding?
Yeah, absolutely. I think we're seeing some similar situations as to what Rebecca had mentioned. It's wonderful to hear and to know there's been such an outpouring of support and this idea that individuals, I think from our experience, especially individuals, are thinking more long-term and being strategic and what can their role be in the larger philanthropy, I think, or the larger philanthropic space. I think that's incredible. I would also add, I think when the whole situation was really starting to unfold, we were really wondering, we work with a lot of corporate foundations and they have been incredibly generous. We also have a couple of employee match campaign portals that we're running, and those have, are garnering a lot of interest, which has been, again, really encouraging. But I think when all of this started, we were really wondering, because this is a global issue, because there are so many needs also in our own communities, in our own backyards, will there be a lot of support for, relief, recovery, response initiatives in Latin America as well? Or will a lot of funding get diverted to other communities, other regions? What will that look like, coming from a place of there are probably limited funds that are generally available for this type of response, and how will they really get allocated? And I think we've been incredibly impressed by our corporate and family foundation, and of course individuals as well, but really looking at those corporate foundations that have really stepped up and wanted to continue and even grow their support in Latin America and the Caribbean and Canada in the wake of this crisis. And I think while it's been, there's been so much interest right now, we're still wondering, just in general, our, especially corporate philanthropy, is that if that's tied to the business, if businesses don't do well, what does that mean for philanthropy down the road? Will there still be these opportunities? And I think the nature of COVID-19 is so much is unprecedented and so much is unknown that we are in a position where we're very grateful and thankful for that outpouring of support right now, but just thinking longer term, what does that look like? Does it mean that if the funds are available now, they're not going to be available later for kind of these, the education, the environmental programming, as these countries really open back up? And I think it's, on a global scale, I don't think it's unique only to Latin America. I think, in general, we're looking at philanthropy as, will this be so, because so much was spent on COVID-19, what will kind of that standard philanthropy look like going forward? And the only other thing I would add as well, I really liked what Saulo said about the, need to diversify funding streams and thinking about sustainability. Some of the other panelists mentioned that. And I think this situation has also really caused us to reflect even more on how can we, in the role that we are in, be able to really support our partners in becoming more sustainable and becoming more self-sufficient, and what does that look like? So we had a great opportunity most recently to work on an NGO institutional strengthening capacity building program, and that we launched it in Nicaragua, brought some programming over from Africa with a family foundation partner. And we've actually seen that cohort get together and do their own trainings now on, okay, what does COVID-19 mean for the civil sector in Nicaragua, and how can we as a network work together and collaborate in order to help each other out and to figure out where there may be funding to access. So I think it's really causing us to reflect more on we need more opportunities like that. So these networks and collaborative relationships within and among the NGO sector and the private sector locally, the government locally, are able to really activate those relationships in situations like this. Thank you very much. Rebecca, you mentioned the informal sector, and I'm going to direct this question first to Saulo because he's in the trenches. In New York City, one of the hardest things is the social distance, especially you had this idea of vertical social distancing, of getting the elderly and the most vulnerable sequestered to allow younger and less risky people to work without having cross infection. In Latin America in general, and Brazil in particular, the informal sector has big problems in this because you have whole families living in small, cramped confines. And there is a racist component as well. I think the delineation is a little bit more general across the income strata. Perhaps you can talk to us what you're seeing in terms of the social distance. I know you're not in a particularly dense area, but maybe some of the other places you have work, and talk a little bit about that. And certainly that's open to anybody on the panel. What are the challenges of that, both whatever type of segregation you have in the different parts of the world, especially in Brazil, where the income by race is posing a challenge, and how are things going in terms of alleviating it? Saulo, you're gonna try and get
Would you like Saulo to go, or I'd be happy to take that on? Yeah, there's a very interesting question that John has summarized about the differential impacts of the pandemic on people of different racial groups. And the question also refers, it mentions that we've talked about gender and the gendered impacts, but which we are very serious, but it also mentions racial impacts and ethnic minorities, and that are impacted differentially, and sometimes in fact the social reactions can be very significant. And so what I will just say briefly as a preface that we've seen in India that the Muslim groups and the Dalit groups, the so-called untouchable caste, have been targeted by social groups, and it's been resulted in violent conflict. And so there's both the fact that there's structural differences in terms of the stratification of the society along ethnic and religious lines, but so there's discrimination at play, but there's also this kind of phobic labeling of the other that we see in South Asia and in India in particular. But with regard to the question about race in Brazil and structural racism, it's important to, I think, compare what's happening in the United States and what's happened in Brazil. And just briefly outlining in the United States, because we all, I think, are familiar with the numbers, the differential impacts of the pandemic on Blacks and Hispanics. Part of the reason is, yes, there is definitely structural inequality in terms of access to health. We know that Latinos and Hispanics and African Americans have much more difficulty accessing good health care, and they also have a lot of pre-existing conditions that are related to poverty. So there's a correlation there that already exposes those communities to being more vulnerable to a pandemic of this type. But there is another factor that's really important to keep in mind in the case of the United States, and I think this also applies in Brazil, which is the people of color are the ones that are actually going out there to work every day. They're involved in the frontline services. They are the essential, the caregivers, the healthcare workers, the support services for the elderly, for the nursing homes. They're stocking the shelves in the grocery stores. They're providing rides on Uber. These people are riding up and down on the subway every day. And so it happens to be because of structural inequalities that in the United States, people of color have been disproportionately impacted by the pandemic. I would venture to say, although we don't have the research on this yet, we don't have data or evidence, but I would venture to say that this person's question is extrapolating and asking whether this is happening in Brazil. I would suspect that it is, especially going back to the informal sector. many of the the majority of the informal sector workers are people from excluded groups. They might be African Brazilians, they might be other discriminated groups, but a lot of these people are still having to go out every day and try to make a living and do something that can support their families. They might be considered essential workers in the healthcare systems, and they also have those either pre-existing conditions or lifelong challenges in access to good healthcare. So we can assume that the more vulnerable groups in Brazil, which are, as you all know, the racial makeup of Brazil has a strong component of African descent people. If you count the pardos and the pretos, it's more than 50%, it's almost 60% of people. And all of the data from PNAD and IBGE shows that the darker the skin color, the less the access to education and employment opportunities. So we can assume that this is also a factor in affecting the more vulnerable and excluded groups in Brazil.
Very good. Saulo, would you like to add anything?
No, I think Rebecca covered very well the issue. I would like to add that Brazil has still a very low capacity of making tests. If you compare Brazil with other countries in the world, we are very bad on that issue. So it's very hard to give a real picture about how Brazil's situation is. I agree, the vulnerable people, the informal workers, they are working because they need to go out. They have no money to buy alcohol or masks, but they have to go to work because they need to survive. But I think we don't have a real picture about Brazil. And coming back to the previous questions about the difference and similarities between US and Brazil, I'd like to add some comments. First, about the difference. I think there is a cultural difference very strong. So the American people, they are creating a cultural perspective of as a donor. So they don't donate a lot, and they donate in a different perspective as well. So they donate for projects that are transformative or innovative. In Brazil, the majority of the people, they donate, but it's small money, mostly based on religious issues. They hope to buy a nice land in the heaven when they die, as close as possible to God. So they donate for this small money for many social care organizations. And about the similarity, I think there is a similarity in terms of mindset. Both sides, they usually like to finance short-term projects. So they like to see as soon as possible the results. So the innovation, the risk, the investment in terms of transformation is still need to change in terms of mind in both countries. Of course, US has much more a path created. They have also income tax subvention, so facilities, compared to Brazil that doesn't exist for ordinary people to donate to NGOs. But I think we need to shape the mind of corporations to change the mindset, and the social donors as well, to think more about long-term perspective. One thing I really hate is when the people divide the amount of money per beneficiary. So if you want to make me angry and maybe violent, tell me about that, because I hate that. And the other thing is very complicated is people that don't understand that complex problem requires systemic solution. So is another thing that make me very angry is when the people look at our model and see, oh, you do nice project, but you have no focus. My most polite answer is that you have a narrow mind. That's the most polite answer I can give.
Well, thank you, Saulo.
I want a quick answer of that, because I'm nodding my head furiously, and that's so desperately true here as well. There are very few major foundations that are giving on any kind of a national scale that want to see more than just their name on a brick or a cornerstone? Or what can you do in 1 year and give me your performance outcomes? And how many dollars will it cost for me to get 7 people through this program? Saulo is absolutely right. That part of what we have to do after the COVID crisis, we being both government and not-for-profits and civil leaders, is sit down and look at the broader perspectives of what foundations and what government can do in terms of operational support and long-term sustainability support. And we haven't really done it on much of a scale here. And even large organizations that have been in existence for years that give us the network to donate quickly, like the Red Cross and whatever, we're not looking at some of these issues. And it's part of what we have to do as leaders in the not-for-profit world, is to sit down with our funders, with our government officials, to work, to look at the long term and to look at this approach and really, really talk about what sustainability means, and then what short-term, what short-term help we can give. So my IT person just came in. So Saulo, I'm going to shake my head yes again. Thank you.
Thank you very much, Sylvia. I was going to mention that all the representatives on this panel take a holistic approach, maybe not attacking all the problems simultaneously, but certainly finding a pillar and then building from there. So all the things that I know the Resource Foundation, when it was founded on housing. And then everything that goes ancillary to having a family unit and housing flowed naturally from that, plus going into sustainable development. And that's true. I've had long experience with the BrazilFoundation as well. It's very, just look at the counterparties. And that brings up the question of due diligence. Not only due diligence on where the funds go. Now, I'm not talking about saying, look what we did kind of thing. Just people that donate, especially ones that do it anonymously, want to see that it's actually going to what they're donating for. But it also has to do with this lovely world that we live in, with lots of fake news, culture wars online, et cetera. How do each of you deal with, first, the due diligence part, making sure that you find good counterparties, make sure that they're using the funds the way that the donors are thinking, and then third, how do you disseminate, especially in the healthcare side right now, because we have a lot of things going around politically, a lot of politicization of treatment, et cetera. And we should start with Christina.
Sure, thanks, Jen. That's a great question. I think a comprehensive due diligence process is definitely essential to how we operate. And I think it's a huge value add that the Resource Foundation is able to offer to the donor clients, again, that we're working with here based in the US. And we do, very generally, we do a combination of equivalency determination and expenditure responsibility. So 2 different IRS accepted forms of due diligence. And my colleagues would be able to tell you the nuts and bolts of what every little thing means. But in general, we're looking really to work with partners that we feel like first and foremost align with our mission, and then that have the capacity and the relationships in order to be able to fulfill the commitments that they're making by being a partner for a particular grant. So I think further to that, we really do also rely on our existing nonprofit and social enterprise network in the region, that if we're looking at a new partner, oftentimes we may be identifying that partner through a reference from an existing partner. I think now with the social media, that of course has become more and more front and center. I think that's also becoming part of what we're looking at when we elect to work with different organizations. But on the backside, we also do have a pretty comprehensive reporting system. Of course, I think a lot of our, I think kind of going back to the previous question about kind of philanthropy and will the situation change how we think about philanthropy? We have established KPIs. What does that mean? Is there more when we're talking about impact? I think we're always working on meeting donors where they're at, but then using our collaboration and relationship as an opportunity to explore additional opportunities. So I think, or explore different ways to think also about impact and about what their programs could look like. You know, if they're very focused on impact, can we talk about a 3-year commitment? You're not going to see some of these results or impact that you really want in only 12 months. So I think, you know, part of our due diligence is also, we have a standardized kind of reporting process that our organizations do submit, you know, photos, testimonials, a lot of different things, but that information is a key piece of us understanding how the organization is implementing the project, but also how they're actually talking about the project. Because I think through conversations and emails, we may get additional insight from the program, but then when they present the reports, we're not seeing that come through. So I think that also offers us an opportunity to do some kind of on the run or in real time, doing some additional capacity building with our NGO partners to explain, you know, you told us this great story about one of the participants, like make sure that gets into the report. These are things that individuals and donors particularly really want to learn about in order to understand the project on a greater level. So I think when we think about due diligence, we have kind of both that initial piece to understand, you know, how the organization is set up and all of that, but we look very closely at the reporting and our ongoing monitoring and the feedback that we get from the organizations to really feel confident about the program and the progress that's being made.
Thank you very much. Rebecca, did you want to chime in on this?
Sure, yeah, and it's really important for us. In fact, it's something that we consider to be our comparative advantage. When we speak to donors, whether they're Brazilian donors or US-based donors, that we have a team on the ground. So we have 10 people on the ground. It's our program staff, and we have 20 years of experience on the ground of working with organizations all over the country. And we have over 600 organizations that are already in the network. So our team, we've had the really good fortune also of keeping our people. So we've had a really long-term commitment of the team that visits on a regular basis, all of the organizations that receive support. So at the beginning, obviously, when a new organization is applying for support, we have a whole series of requirements in terms of their legal identity and their transparency in terms of financial accountability and their governance structure, their responsiveness to the local community and how they systematize that. So we have these criteria in the beginning, and then over time, organizations that we have supported also receive site visits and monitoring visits, and we also bring the grantee organizations together once a year for a capacity building workshop, and that's an opportunity for networking among them, and that builds also that network that Christina talked about, so it can generate and spin off new organizations that might come into our orbit for support. But those capacity building workshops are also an opportunity for our team to assess the level of success and the results orientation of the teams of the organizations that we're supporting. So we really have, there's a lot of concern about knowing firsthand who it is that we're working with. And we like to be able to convey that to donors, because so much of our support comes from individual donors or families who want to know who are these people that we're supporting and what is it that they do. So our team, keeps in really close touch and on a regular basis goes to the field to kick the tires of the project. Because we work at community level, this is essential to who we are, and we also feel that it really helps build up that infrastructure of a network of really strong community-based organizations.
Great, thank you very much. We have a couple more questions. Just first, there was a question from the Humana People to People Network asking, how did you all adjust so quickly to this pandemic? It's very clear that all three of you were able to get things in place very, very quickly. If you could give us just a quick rundown as to how you were able to do that. And of course, you've already talked about the question of what happens later, but please give us a quick rundown as how you did that.
Sure, I can start. I think it all boils down to our network. So the fact that we had, we have strong relationships with our network in all the different countries. Again, because of the uniqueness of COVID-19, it is so regional. We were able to reach out to, had a pretty strategic way of reaching out to as many partners as we could in waves, really having all staff, all hands on deck. Our staff are bi and trilingual, so able to really get that information from our partners right away, and speaking with them in the language that they feel most confident in, and really to understand. Well, I think first and foremost to say, we're with you. We're not calling to check in on, make sure you still do this project exactly like you said. We want to make sure, like, are you, your family, the team, are they okay? And then what are you seeing? Are you involved in response programming? What does this mean for your organization? So I think really just activating that network gave us the information that we needed to then be able to go to our corporate funders in particular and say, this is what's happening. How do you want to get involved?
Rebecca?
I would say, our experience is very similar. We worked, long hours to be able to set up the vehicles to receive funding. And then we did go to our network. We did not send out a call for new proposals because we knew that would take too much time. We really relied upon the organizations in the field, in the communities that we knew we could trust. We knew they were very, long-standing and trusted partners. So our initial funds went to those organizations, and then as time passed, we widened the net and have, now reached 24 different organizations, but none of them are unknown quantities. They're all organizations that we have worked with, we feel very strongly about, precisely because the normal due diligence procedures, we just don't have time to do everything, and we can't go out to the field to visit the projects. So we're relying on the network that is in place.
Thank you very much. We're coming to the end of our time. The last question is actually an economics question. We have two clear trade-offs that society is facing in this pandemic. The first is producing regular goods or emergency goods. Right? And we've had to try to redeploy our labor force, not doing it so well, certainly looking at the initial claims numbers today, et cetera. So, and then the second is we have a trade-off. We're bringing forward a lot of spending, and how do we deal with that later, especially the huge fiscal deficits we're going to have. We will we'll definitely be addressing this in a future Zoominar. This is certainly what is going to be the fallout once we get to the other side of this, because we are bringing forward a huge amount of consumption to try to contain the pandemic, and we'll see what happens later in terms of the fiscal side, et cetera. So we have two economic trade-offs, but we'll leave that for the next time. Just a quick note on the Brazilian American Chamber is we have many members that are non-for-profits. We actually have a preferred membership rate for non-for-profits, and we have quite a few, but we welcome many more if you'd like to join. And we'll be having sessions like this, whether remotely or not, in the future. So I just want to thank the panelists for a fantastic panel, and thank you all for joining us. It was really great. You will also be up on the web, on YouTube, and hopefully also it'll be on our website and distributed through Facebook and other social media. Thank you all again. Fantastic, fantastic panel.